Hello everyone. In this video, we will discuss about Tolvaptan pharmacology in a simple and exam-oriented way. The drug is called Tolvaptan. V means V2. Receptor ANT means antagonist. That is, it is V2 receptor antagonist. So, Tolvaptan belongs to the class of vasopressin receptor antagonist, also called as Vaptan. So, it's a selective V2 receptor antagonist. Mechanism of action. To understand the mechanism of action, first remember the action of ADAs or vasopressin. Normally, ADAs act on V2 receptor in the collecting duct of kidney. This leads to insertion of aquaporin 2 water channel, which causes water reabsorption. Tolvaptan normally blocks V2 receptor in the collecting duct, which inhibits insertion of aquaporin 2 that in turn prevent water reabsorption and causes free water excretion. This process is called aquaresis, not natriuresis. So, urine volume increases, urine becomes dilute, and serum sodium rises slightly. Remember, tolvaptan causes aquaresis without significant sodium loss. Now, I am talking about pharmacokinetics. Tolvaptan is given orally. It has good bioavailability. Onset of action occurs within 2 to 4 hours and it has half-life around 12 hours. Tolvaptan is metabolized mainly by liver, by hepatic enzyme and excreted through feces. Pharmacological effect. The major effect of tolvaptan are increase urine volume, decrease urine osmolarity, and increase serum sodium level. Importantly, it does not cause major electrolyte loss. Clinical use. Tolvaptan is used in two major clinical settings. First, hyponatremia, such as euvolumic hyponatremia including SEERD and hypervolumic hyponatremia including heart failure and cirrhosis. Another and use is, and it is most important, is ADPKD. In ADPKD, tolvaptan reduce cyst growth, slow decline in EGFR and delay progression of ESRD. Common adverse effect of tolvaptan includes polyuria, nocturia, polydipsia, dry mouth, dehydration. Drug interaction. As tolvaptan is metabolized by CYP3A4 inhibitors, so enzyme inhibitors such as azole, macrolide increase tolvaptan level and enzyme inducer reduce its effectiveness. Now, I am focused on tolvaptan in autosomal dominant polycystic kidney disease historically based on KDIGO guideline 2025. Why tolvaptan delay CKD progression? ADPKD progression is mainly driven by vasopressin mediated cyst growth, increasing cyclic AMP, and progressive kidney enlargement and fall in GFR. So, tolvaptan is a selective V2 receptor antagonist. It blocks vasopressin action and reduces cyst fluid secretion. As a result, slow total kidney volume growth, TKV growth, and declining in EGFR. We already discussed it on mechanism of action. Who should receive tolvaptan? That is indication of tolvaptan. Tolvaptan is recommended in adults with ADPKD, who has EGFR more than 25 ml per minute per 1.73 meter square area and are high risk of disease progression. High risk of progression defined as Mayo Imaging Classification 1C, 1D, and 1E, or historical EGFR decline more than 3 ml per minute per year. So remember, Mayo class 1A and 1B is not included here. Here 1C, D and 1E is included. Who shouldn't receive tolvaptan? That means contraindication to tolvaptan. There are some absolute contraindication and some relative contraindication. Absolute contraindication includes pregnancy, breastfeeding, advanced liver disease, inability to maintain adequate water intake, patient with slow progression. And relative contraindication includes EGFR at initiation less than 25, history of gout and urinary incontinence. Dose and titration. The guidelines suggest a stepwise approach. Starting dose is 45 mg at morning and 15 mg at evening. Up titrate weekly if tolerated. Morning 60 mg and evening 30 mg. Target dose is 90 mg at morning and 30 mg is evening. Morning dose is higher usually to maximize the daytime accuracies. Dose reduction is allowed if there is side effect, that is pore intolerance, any side effect and drug interaction. Then down titration of drug is needed. Evidence behind tolvaptan. KDIGO summarized the data from two trials. Number 1, Tempo trial and Reprise trial. Here, the study shows tolvaptan slows EGFR decline by 1 ml per minute per 1.73 meter square per year. It reduces the growth of total kidney volume. General benefit and greatest benefit is found in younger people, usually less than 25 years. Adverse effect and the counseling. The common adverse effect is due to aquaretic, that is polyuria, nocturia, thirst, polydipsia. This is aquaretic effect. These are expected and usually dose dependent. So counseling is very much important. The key counseling are advise patient to increase more water, avoid dehydration and expect lifestyle changes, that is frequent urination. Hepatotoxicity and monitoring. We know that liver injury is the most serious effect. So, mandatory liver function test monitoring is needed. Baseline monthly for first 18 months, then every 3 monthly. Tolvaptan should be held if AST and ALT raises more than 2 times from the baseline, and if ALT AST rise more than 3 times of the upper limit, then discontinue the drug, permanently discontinue. Actually, most liver injury occurs in the first 18 months, so frequent monitoring is needed on this time. There are some sick day rule, sick day plan. KDIGO advises temporary discontinuation of drug during diarrhea, vomiting, poor oral intake, any febrile illness, and limited access to water. On that time, temporary discontinuation is suggested. KDIGO not recommended, not recommended somatostatin analog, SGL2 inhibitors, ketogenic diet. Rather, KDIGO advises to take water as a replacement therapy to prevent dehydration. So, in brief, Tolvaptan, according to KDIGO 2025, it is the only approved disease-modifying drug in ADPKD. Start if EGFR more than 25, more than equal to 25 ml, or if there is any features of rapid progression, that is Mayo class 1C2, 1D and 1E, or rapid decline more than equal to 3 ml per minute per body surface area in year. পার ইয়ারে 3-এর বেশি কমে গেলে আমরা করব। মেজর অ্যাডভার্স ইফেক্ট ইন কেস অফ tolvaptan is polyuria and hepatotoxicity, so strict liver monitoring is mandatory. This is all for today. Thank you very much.